Hello, I'm Dr. James Bogash. I'm the author of the articles on modernhealthmyths.com, and today we're going to tackle the very controversial subject of vaccination. In today's video, specifically the the HPV, or the human papillomavirus, otherwise known as the cervical cancer vaccine. The idea behind the vaccine is that there are certain types. You understand that the human papillomavirus has multiple types. I call them cousins, and there are a couple of cousins that have been linked to increased rates of cervical cancer. So the idea is if we can vaccinate against them, then we can potentially protect against against the development of cervical cancer. That's many times in medicine a huge jump between guesswork and actual reality. We've seen that in time and time again in other interventions, whether we're talking about statin drugs or cardiac procedures, anything like that. So one thing you need to understand is we call it the cervical cancer vaccine. To date, there have been no studies that have shown that the HPV vaccine lowers cervical cancer rates. I cannot stress that enough. If somebody tells you that it lowers rates of cervical cancer, or your doctor, it means they have not and do not understand the medical literature surrounding this particular vaccination. It has been shown to lower risks of the precursors of cervical cancer, but there are no studies to date that have shown that it actually lowers cervical cancer rates. And again, if this particular vaccination, out of all of them, there's a long list of potential side effects. If there weren't any side effects, then sure, it might be fine. But considering that it's been linked to things like POTS syndrome, that is an alteration of the nervous system, especially the sympathetic and parasympathetic nervous system. And there's just, of all the vaccinations out there, this one seems to have more problems with it. And keep in mind, it is not, I've said this, it has not been shown to lower cervical cancer rates as of the recording of this video.